On serious note, a fantastic session, and this takes us to the next fantastic speaker, who we have. Here is Mr. Bharath M, and he is the Vice President, Global Business Services Advisory, Everest Group. And Bharath, with that, may you please join us?
All right, thank you. Thank you for the introductions, and great to be part of this symposium. It also makes my life a little easier to come in the end. I also get to sum up a lot of themes that we've been discussing otherwise. I have about 10 minutes, probably will take 9, but the idea is to cover points mainly around innovation, right? One of the things that we do see in today's age of pharma is how things are getting borderless, right? If at all anything, some of our leaders on the stage here, like Sadhna, Suneela, they are literally, portraying how India for global in action, right? In the form of global capability centers or GCCs. I've got few content, some interesting provocations to bring all of this together, and we'll get going if you can. Yeah. Okay. All right. Innovation could mean a lot of things, right? It could mean new molecules, new methods, sometimes new acronyms, sometimes new dashboards. Hopefully someone reads them. And sometimes they try to have the courage to try more again and again. Hopefully not have AI and agentic really come and do the session on our behalf, right? Let's talk some key trends that's really driving at an overall level, not limited to drug development per se. We see 4 broad themes out here. And each of these themes can itself be, a longer session. I'm going to quickly run through these. Predictive and preventive, we are going beyond reactive ways of, doing things. Precision, we are getting precision right from treatment selection to clinical decision making, of course, in drug discovery and development. Consumerism, it's not just what we develop, but how that also gets used in the market. Equitable, accessible care, point of care, areas like commercial analytics and all getting really big at this. And of course, digitization, right? The care is moving beyond physical locations, connected devices, optimized workflows, and so on, right? But I want to also talk about this bonus trend about borderless and how the industry is no longer limited by locations, right? For example, there is an organization in India, their GCC or their Global Capability Center is helping develop solutions that can accelerate drug development submissions in preclinical stage. And that organization is not sitting in a wet lab or in an actual drug development facility. It's a tech center that's using AI, ML, and solutions to actually accelerate something. And it's tying back to Sadhna's point. We'll talk more about the need for building that context and global talent to be able to do this. But you've got people in India who are literally supporting Cambridge and Boston at ease, right? Driving patient-centric impact at scale, operationalizing AI, right? Creating integrated compliance hubs, unlocking commercial agility. Essentially, we are moving away from thinking, traditional ways of doing things. In fact, if this industry is anything, it's in the last 10 years that I've been observing at Everest Group, it keeps telling me that limitations on what can be done from locations like India are mostly self-imposed, right? Kind of work that's happening is simply outstanding. Innovation specifically in life sciences is moving faster than ever. We saw some of that through the day, right? AI-led molecule design is already moving to quantum-related areas. Dr. Shridhar was mentioning about some of that when we were speaking earlier. Right? We're moving away from static trials to adaptive real-world trials. Lab testing is moving away to more in silico. Patient recruitments are starting to get more AI-led, better stratification. We are, as I said earlier, from reactive to more proactive and even preventive sort of tracking of patients. Net, the industry in itself is moving at a very, very fast pace. But, right, most companies are still struggling to keep pace, right? We did a survey of CXOs in the global pharma space, not just limited to India. And more than 90% of them believe that there is a fair degree of innovation debt. And a lot of this is actually based on traditional decision-making methods. One of the things I really liked about this event's topic was it was not just R&D, it's R&D leadership. Right? A lot of this is going to be around mindsets, around how you make things happen. right? Let's dive a little bit deeper into some more of these numbers, right? What are some additional factors that's causing these innovation debts? Siloed data, right? We're talking about need for advancements in R&D, but at the same time, it has to be backed with pragmatic views on how we use data, right? Often there is over-reliance on manual processes, compliance-related needs, sometimes insufficient use of analytics. Again, the stat earlier that Sadhna had showed very rightly, flowing into this, and of course, sometimes hierarchical decision makings. And what are some of the consequences, right? Fragmented cross-functional collaboration, even in leading organizations, different therapeutic units don't end up talking to each other, right? Reduced efficiency in clinical trial planning, underutilization of scientific, real-world evidence, and so on and so forth, right? This is where I want to throw the provocation, right? We've cracked the code for molecules in some ways, right? Yes, there are more things to find out, more things to address, but at least the approach to doing this is sort of there. But now, how do we crack the code for momentum? And where does really India fit in? The next panel, we're going to talk about how India can accelerate some of this for global, but this is truly where we are, right? How can enterprises really unlock this innovation momentum? Some areas that we see as going to come in include connected data foundations, especially cloud-native platforms. Next-gen pharma is not just going to be on technical and domain expertise, it's going to mix AI skills. Sadhna, we would generally use the term, we started using this term called full stack humans in our organization. People who have domain, technology, empathy, all of these together is going to be critical. You won't have IT separate, operations separate. You need to have people who understand both. Integrated science and technology hubs, of course, embedded governance, future-ready models, platformization, and also outcome-led impact, right? Innovation, not just around certain, the spend, but more around what is the value it's creating, right? Ultimately, it's going to, fall down to 5 disciplines, and we've sort of put a nice acronym around it. It's going to be around connected leadership, advanced data foundations, resilient networks, of course, ethical governance and sustainable impact in terms of ROI, right? We strongly believe that these are going to be critical pillars as organizations truly look at scaling the impact, scaling the contribution to, getting drugs faster to patients, equitable care, and so on, right? I just wanted to leave the group with these points. We have mastered molecules, time to master the momentum. With this, I would invite the panelists for the panel discussion, and then we'll continue the discussion further. I'd love to invite Dr. Vinod, Dr. Sadhna, Dr. Shridhar, and Suneela. All right. This is an interesting topic on innovation, globalization, and going beyond an organization to the whole ecosystem, right? And we saw some of these earlier, but I still want to start with a provocative question, right? And I'm opening it up for all the panelists. As India builds the next phase of its R&D ecosystem, what do we need more? Do we need more deep specialists or more interdisciplinary scientists? Does anyone want to take a shot at that? Deep specialists or interdisciplinary scientists?
I'll take a shot. A strategic mix of both, and depending on where we are so where does India want to contribute in the innovation journey, you will have to balance out which one plays up more than the other.
All right. Shridhar.
I completely agree. I think in today's day and age where technology is coming into every aspect of research, including biomedical research, I think it's going to be more of interdisciplinary kind of scientist. Yeah.
I would agree with that. I mean, deep science, we absolutely cannot ignore that, and we are going to need that given the advances. But finally, we need folks who bring it all together, who understand the deep science, but also know how to use data analytics and also how to kind of leverage AI ML. So we have to see how we nurture deep science, but at the same time develop our workforce to be more and more interdisciplinary.
I think it's always going to be a mix. I don't think it is either or. My personal bias is for interdisciplinary capabilities. That will, in my mind, always trump deep expertise.
But I think interdisciplinary is sort of winning versus deep, not at one's cost, but still, yeah. The next one, a bit more for maybe Sadhna, Suneela. You've been in both domestic or country-specific R&D units, and now you're also supporting global delivery. Right? As R&D becomes increasingly borderless, as newer scope of work is being done, what has been most important shift that you've observed? Right? Is that more in terms of talent capability? Is that more in terms of certain operating constructs or even the mindsets? What is it that India has had to make to truly go beyond local and support global?
So if I may, I think it's the mindset very clearly. And how to really move from a delivery mindset to an excellence mindset and mindset of accountability, that's going to be the crux. I think we have all the right factors. We have the science, we have the technology, and we see that we are also blending this well. But one factor, if it comes in way of our becoming really, a truly global center, I think it's the mindset. Somewhere, there's still a little bit of a tendency to wait for a quote-unquote command, and that needs to change, and how we can take more accountability, more ownership of end-to-end process. That's going to, I think, define the journey from here, in my view.
So, two great minds think alike, and fools seldom differ. I don't know what you want to call us, but the fact is, it is mindset. I think we need to, and we have moved to some extent, but move from seeking permission to taking initiatives and leading. And if you want to lead, you need to pivot to an enterprise mindset. It can't be about, I'm doing this, India's great at this. It has to be about what the corporate needs and what is in the interest of the greater organization. So enterprise mindset, impactful communication, that's something that I've seen sorely lacking. Communication, yes, we saw this today also. But succinct communication, your measured, impactful communication is the second one, and smart risk-taking. These are the three things from a mindset perspective which will take India from a reliable, efficient, operational model to a leader and a strategic partner. We can also think about corporate mindset. So we've been talking about individual mindset, but if you look at it from a company's perspective, and you spoke about borderless R&D. Now, if R&D is to move, cutting across geographies, then it's important that decision-making also moves cutting across boundaries. You cannot be sitting in Europe and US and saying, I will make all the decisions, but I want this enterprise mindset and I want leadership qualities, because you're not developing those leadership qualities. You're constantly telling people what to do. So that needs to change completely. And the whole mindset barrier about time zone difference. The minute you decide to open the borders, you are telling the world that time does not matter. And then if you decide not to play senior roles in Asian countries, saying that there is a huge time zone difference, then fundamentally there is something wrong. So to me, those are the key things from an operating model perspective and mindset. But make no mistake, Bharath, to me, it's all hands mindset. Because if every one of us starts thinking and acting as owners of that global pipeline and not as custodians of tasks, then operating model and talent capabilities, I think rewiring those will be a child's play.
Correct. I do. Oh, sorry. Go ahead.
Sorry, sir. I want to be a little bit provocative here, right? I want to ask the audience, how many of you want to be an entrepreneur? I've got six people saying they want to be an entrepreneur. And that's exactly what both Suneela and Sadhna were referring to, right? Is, do we have that mindset to change and take a risk? You know, people ask me, at my age, why am I doing this? Right? Is there a need? I could be very happy in a corporate job, doing, you know, R&D for a big pharma from India or a multinational. Why do a startup at this age and try to, you know, go convince a VC somewhere? And madam, one request is next time bring in a few of the investment community as well, because I think they need to really see that there is so much happening in India in terms of research that needs to be funded, right? So when you talk about risk appetite, right? Sadhna talked about taking smart risks. If you don't take smart risks at your age, when you get to my age, you're not going to do that.
You're not that old.
Well,
I also wanted to make a kind of comment on this one. I think it's a bit of a chicken and egg. And we must recognize the fundamental structural disadvantage that we have here in India. Most of the innovation happens in corporate offices out there. And we have a mindset of implementation. We do provide input, we participate, we like to think ourselves of you know, even strategic in some ways, but we're still not corporate. Until that equation changes, it is hard to imagine that individual mindsets can make a lot of difference. I see that is changing. I mean, there is, you know, now global product teams now based, you know, stationed in Asia. That is happening. I see, you know, the GCCs might make, you know, create an additional momentum. China has already proven that. So we need to see some acceleration before the mindset issue can be discussed meaningfully.
No, that's a great point, right? And just building on that, right? As we fuel that mindset with confidence, what are some approaches that you've seen work very well, especially for Indian talent to build that expertise, right? Both in terms of domain depth and also in some ways the corporate context, right? Plus maybe soft skills or essential skills, however we put it. Anything that you've seen work really well that's helping us, our talent, lean in better with global enterprises and build that corporate context? Yeah.
I think we lose maybe the top 1% of our talent to the US and some of the other geographies. But there is still a significant number of the top 10% which still remains in India. I don't think we are using them very effectively. Right? I think as a country, we are not encouraging them. We have always said, agar IIT mein nahi mila, you're no good. Yeah? Agar AIMS mein nahi mila, ya Bombay mein koi college mein nahi mila medicine mein, then you're no good. Right? But I think that entire mindset needs to change, that today entrepreneurs are not coming from only the IITs. You go to any tier 2 city, you go to a tier 2 university, you are having more entrepreneurs come out of those places than just the IITs. So I think the cream of the NITs, the VITs, or you know, any of these places will do far better than an average IITian. So we have the talent pool, we need to encourage them to go to that next level. And I think that's where the difference will come for India to, you know, make that talent pool into really something that will change the way the world views us.
Got it.
Yeah. And just wanted to add a different perspective. Completely agree with Dr. Shridhar here. And as we are in the, you know, this healthcare and pharma segment, I mean, one thing I feel has helped to develop that right context is really having a purpose-driven culture. Our purpose at the end of the day is to bring medicines to patients. And it's very easy when you're in a global capability center, we completely focused on the process and forget why we work day in and day out. I mean, what's our ultimate goal? And having that purpose-driven culture, the patient principle, as I would call it, to look at your work from the point of view of the patient who is waiting at the end of this value chain. That does help. I mean, that in my view is the beginning. And then, to get more of that global context, it's not easy. I mean, I'll be very honest about it, but you have to also kind of, market your talent in a way, make sure that there is global exposure by way of assignments, by way of, talent exchange programs, by way of, special assignments, what have you. So you have to also be a little bit of a pushti here. But first step is really preparing your talent by giving them that right exposure to what we stand for.
Got it. Any general examples that you would share? I mean, it need not be any specific company, but in which you've seen something that's maybe you initially thought, hey, is this even feasible from India to global, and then you've seen that really work well. Any such examples where from here we've been able to contribute significantly from a global corporate standpoint?
So, I can give you a few different examples, but I refer back to what Dr. Khorakewala said in the morning and what he's achieved. Right, it took 25 years to get from where he started his journey to actually putting a drug on the market. I think we've done this repeatedly from organizations in India where we've developed molecules all the way to either a phase 1 or a phase 2, and then found a global partner to take it forward. Right. Unfortunately, I don't think any of them have actually made it into a drug for various reasons. Right. It's not because of whether they were good molecules or whether they would actually be commercially successful, any of those. Commercial strategic regions, they all got dropped off, right? There's only one case which I know of, and please correct me if I'm wrong, was the one from Orchid, where my team delivered the antibiotic molecule up to phase 1, and then it was licensed to a company in Europe who took it forward all the way to phase 3, got it approved, and now the molecule is back in India and is being marketed by Cipla. Right? So I think there is enough talent pool to at least get that started. Do we have enough talent pool to reach 100 drugs? I don't think so. I think we really need to build that, and the time to build that is now.
Got it.
So just to add briefly, you need a concerted effort to celebrate even small incremental innovations. And that's a culture that we've carefully orchestrated and instituted within Novartis, to the extent that, of course, you have a positive phase 3 readout, and that's submission enabling. The whole world within a company will smile and applaud, and you'll have tons of mails flowing around the world. But we also acknowledge and celebrate failures where we know that the failure is because of biology and not because of something that we could have done differently. So if the biology fails, there's nothing anybody can do. So we actually have, and I'm not talking about India, I'm talking overall within a drug development organization, that we celebrate, in a way, these failures by saying, you did a great job because you did everything that was possible, and if biology fails, that is the unpredictability of human biology. But what are the learnings from this that we can then apply to others? And India has done remarkably well on some of these parameters.
Got it.
I'm not so gung-ho about this, but I think nurturing talent is something that has to flow right from the top down. I mean, you cannot do it. Occasional examples don't make the summer. The private industry does well, I think. I have personal examples, and I had a quota of number of people that will go out, stay out for a couple of years, come back, and then we'll develop. So there are several examples like that in the private industry. But for a country to prosper like that, there has to be a government framework. I sometimes wonder whether we would not benefit more by having our, for example, and I see Dr. Mehdi here, our regulatory office people go and do some regulatory training, for example, meaningful regulatory training. And I know it's not a politically correct thing to say. Similarly, I interview for various positions. It's a struggle to find good, competent people. I mean, we may have an occasional talent, that is God's grace, somebody's genes, but there isn't a framework to have, specialized talent. That has to come from someone from the top, and that I don't see that here. And so my apologies, I'm not as gung-ho as others here.
So I'll tell you one of the reasons for that, sir. If you were to compare the salary of an entry-level IT graduate...
You're giving a reason. That's fine.
I'm giving a reason for that. And I think that needs to change at a level which is an organizational level. Would you as an organization would be willing to pay a master's in biology a 50,000 starting salary or a 1 lakh starting salary? The answer is no.
So therefore, we should incentivize talent. So we should then pay them accordingly. If that is what is required, then that is what we should force. It cannot be left to an individual or one's company to be able to do that. It doesn't work that way.
I completely agree with you. So I think it's at an organizational level, top-down approach, what you're talking about. The top has to make that decision, right? The bottom may demand it, but the top has to still agree to doing that. And
Exactly
if we
what
are
I'm saying.
able to do that, you will change the ecosystem.
Saying exactly the same.
Absolutely.
The top has to work.
All right. No, interesting themes, right? Shifting gears a bit, we also talk about ecosystem. We talk about a bit more on digital. Talking specifically on digital, right? Often we also hear that many digital initiatives do not scale in emerging markets as much as we see in some of the other countries. From your experience, what sort of usually breaks, right? When we really talk about scaling digital, is it simply the technology? Is it the operating model? Is it the adoption? Just curious to hear when it comes to tech for emerging markets.
From my perspective, from a clinical research industry, I don't think technology fails. I think we fail technology. Because again, I have my own opinion about this. Technology solutions are created for corporate. They do not necessarily take into account the reality of emerging markets. I'm now talking about India and maybe some countries like that. They do not take into account things like staff turnover. They do not take into account rural, urban. They do not take into account several things. And then there is no great input into, and many times, and I've seen this in our company as well previously, these new AI, IT, new digital solutions will generally tend to be above an old process that was already happening. So it's not really reducing work. It is actually adding a few more things, and the parallel flows of PPTs and WhatsApp is still continuing. That will change. I mean, I have some good examples of how we change in our own company. For example, for everything that we want to digitalize now, we first run a Kaizen. What is the process? We don't want to build it on yesterday's process. What is an efficient process here? How do we build it? So that has to change. So I don't think it's technology when it fails because the upstream adoption and the operating model.
Yeah.
May I?
Yeah.
3 interesting tidbits. And I'm not referring to emerging markets. I would refer more on a global scale in terms of technology and AI specifically. Number 1, let's say if you require 100 hours to implement a new AI tool, whatever it is, right? Whether it's Gen AI, non-Gen AI, but 100 hours, that is what the organization budgets, okay? X hours, I'm just taking an example of 100 hours. What people forget is that you require another 25 hours for training. So 1/4 of what you require for implementation is required for training. And most interestingly, you require an equal amount of time, which is another 100 hours for change management. You speak to the, very often you will hear the so-called chief technical officer, chief digital officer of a company saying that, oh, we'd not budgeted for so much. It's because all you budget for is you will pick up some technology and this will be the cost. And what you do not budget for is this incremental piece. So that's the first tidbit. The second one was an interesting article I read some time back, This was a data for the first 6 months of last year. So January to June of 2025. And the question was, how much was the reduction in headcount because you implemented a new AI tool? Because that's what you're doing it for, right? Everybody keeps talking about saving time, reducing work, increasing efficiencies. Now, if all of that is happening, you should require less people to do that work, which means you should be able to reduce the size of the organization. Do you know the answer? What percentage of headcount reduction was due to some AI that was implemented in the first 6 months of 2025 across the world? 1%. 1%. Then the chief financial officer gets into the return on investment calculation and then says that the technology is not working. But that's actually not the case. It's because either you've not budgeted or you've not given enough time. And the third piece is everybody keeps talking about Gen AI, and first of all, we'd never use the word, or we'd never expand the term AI to say artificial intelligence. We always say augmenting intelligence. So it's a tool to augment human intelligence, and we're very clear in our company about that. Now, if you're saying this, if you look at so first of all, even if it's AI agents, it's any AI, Gen AI, it is not error-free. AI is making errors faster than humans can catch. And on an average, what's called as AI accuracy, or let me put it reverse, AI error rate is anywhere between as low as 3% to as high as 25%. Now, if you use an AI, Gen AI app, which is at 25% error, and you take away the human being from that loop, God save you.
It's, really the implementation methodology in my view, and how you set the context. Unfortunately, the context is set that, oh, we are doing it so that we build efficiencies, and already, the receivers are looking at it as, oh, this is going to take away my job. And that, fundamentally means that, you're going to have an adoption failure. So it's really all about how you set the context and how you encourage your workforce and explain to them that future belongs to people who know how to work with AI and not people who shy away from it, and giving them that confidence that, this is not for replacing you, but this is just to make you more efficient. I think that's where we are making a fundamental error, and my personal experience has been, rather than making it top down, if you make it bottoms up, if you have change champions, you have, early adopters who can then, really act as the catalyst, that helps.
I agree. In fact, I think there are two problems that we should fix quickly. Number one is the problem of ownership. At least what I've seen, it's unclear to me who owns this. Is it IT? Is it operations? Is it quality? And it is different in different companies. The second is we should incentivize it by output, not by FT, as Sadhna was saying. I mean, we tend to still work on FTE, and there is no incentive, therefore, to optimize this for outputs, functional outputs. And I see in many ways. For example, you talked about data being in silos. It shouldn't be a huge thing to integrate data now, but if you do that, your FTE requirement will become less. I think, I suppose. But therefore, you miss the wood for the trees.
Yeah, the opportunity to do more, the other way to.
We could optimize it for the output, incremental benefit it gets, but we don't do that. My apologies, did I?
Correct. So we are just in the last segment, probably just 2-3 minutes. This is where I get to put the panelists in a spot. No, hopefully not. So we're going to do a rapid fire questions. I don't have hampers like Karan Johar, so bear with me. That's a disclaimer.
I have done enough damage to myself already, please.
Okay, so looking forward to quick one-line responses from the options I'm sharing, right? Dr. Shridhar, we'll start with you. AI and major R&D breakthrough. Where do you think it will show up fastest? I'll give you 3 options. Is it in target identification, clinical trial design, regulatory submissions?
Clinical trial design.
Okay. Sadhna, Gen AI for R&D, what excites you the most right now? Is it accelerating literature and hypothesis generation? Is it predicting trial outcomes early? Or is it automating documentation and compliance?
Predicting clinical trial outcomes early.
Okay. Suneela, for next-gen therapeutics, what's the biggest unlock India can realistically deliver? Is it discovery, early research? Is it scalable process development or faster clinical execution?
Faster clinical execution.
Dr. Vinod, when it comes to mRNA and cell and gene therapies, what is a tougher challenge today? Right? Is it scientific complexity? Is it manufacturing and scale up, or is it regulatory readiness?
Regulatory.
Okay. I didn't even end the options. Okay, back to you.
Says this after all the regulators have left.
Okay, to future-proof pharma R&D talent, what matters most? Deep domain expertise, data and AI fluency, or ability to work across biology, tech, and engineering?
Ability to work across domains.
Interdisciplinary, okay. Yeah, I should have preempted that. If R&D could remove, Sadhna, if R&D could remove one bottleneck tomorrow, what should that be? Is it slow trial recruitment, late-stage failures, translation from discovery to development?
Late stage failures.
Late stage failures, okay. Okay, Suneela, right. To accelerate progress on tropical and neglected diseases, we had one panel, very good inputs on that. What's more critical in your view? Sustained funding, global local research partnerships, or faster clinical and regulatory pathways?
I would say faster clinical and regulatory pathways.
Pathways. Okay. Dr. Vinod, what enables breakthrough science inside large pharmas? Is it freedom to challenge existing hypotheses, access to cutting-edge platforms and data, or strong academia industry collaboration?
I think none of the above. I guess the biggest incentive to the R&D process is the unmet medical need and the potential of producing something that is also commercially meaningful. To me, that is number one. Can you repeat the other three?
Freedom to challenge existing hypotheses, access to cutting-edge platforms and data, and strong academia industry.
Access to cutting-edge
data. All right, so we'll leave the audience to decide the winner. I know it was not a competition per se, but I think we had some really interesting points. The few that really struck with me are how we look at outcomes versus, obsessing over specific tasks, right? How we look at some of these things as a cultural element and not just as an initiative, right? Some of this coming top down, how there is scope, while we are already doing a lot, but there is scope for something that's broader, beyond individual organization or at an individual level. But more importantly, going back to the first question, right? How mindsets is probably going to be our biggest strength when it comes to scaling India for global, more than technology, more than data, more than domain expertise. Huge thanks to panelists for being a sport and taking up these rapid fire questions as well. And thank you for audience for listening to us.
And thanks to you for making it so alive. Thank you.